Here's a medical thing they don't tell you. Cancer has 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 is usually limited in one spot. Stage 2 is maybe that same spot but a little bit bigger of a tumor. Stage 3 is now when we get local spread, maybe it's entering the lymph nodes. And stage 4 is the most serious. It means that wherever it started, it has spread considerably to other parts of the body. So for example, if you had a lung tumor, but then you also had a tumor in the brain, likely that lung tumor is what moved to the brain. That's considered stage 4 because the primary cancer, although it was in the lung, has spread to the brain. Sometimes that same lung tumor will spread to the colon, the liver, and so on. It just depends on what organ it wants to end up in. Traditionally, stage 4 cancer, in most cancers, has been more difficult to treat because surgery is usually, again, usually, not always the case, usually reserved for earlier stages of cancer, because if you have one spot in the lung, it's easier to resect. But if you have a spot in the lung, 3 spots in the brain, 2 spots in the colon, you can't feasibly do surgery on all those different locations. So essentially what happens is those patients end up getting committed to long-term chemotherapy, or nowadays, which is the exciting part of being a cancer doctor, we have things like immunotherapy and targeted therapy, which sometimes work really well, and other times they have their side effects, but in general, they're still better than chemotherapy.